Okay guys, so let's talk about esophagus. It will be helpful for your surgical readings. What's the extent of esophagus? So basically it starts from this lower border of cricoid cartilage to gastroesophagus junction. Length of esophagus is around 25 to 30 centimeters. And let's talk about constriction in esophagus. So basically guys, there are three constriction in esophagus. One constriction is at a starting point of esophagus, that is due to cricopharyngeal muscle. So basically it's 15 centimeter away from incisor teeth. So from there esophagus starts. Then second constriction, let's talk about second constriction. So you need to know about structures around esophagus and relations. So this is perfect diagram, I guess. Esophagus is behind this trachea. Okay. Second constriction is due to this arc of aorta. So let me show you. The second constriction is due to this arc of aorta, which is crossing the esophagus to goes behind it, and it's also due to this left menstruum bronchus. It's due to, like, see, esophagus is in between this left menstruum bronchus and then arc of aorta on behind of it. Now let's talk about third constriction. Third constriction is due to this gastroesophageal junction. So it's basically like a physiological constriction. So there are three constriction in esophagus. Now we will see this one too. See, this one is a pharynx, nasopharynx, oropharynx, and then this hypopharynx. So this is cricoid cartilage. Esophagus starts from this lower border of cricoid cartilage. So there are four layers in esophagus. One is mucosa, second is submucosa, third is muscularis propria, and then fourth is adventitia. There is no serosa in esophagus. Okay, so muscularis propria is having inner circular muscles and outer longitudinal muscles. They both are required for peristalsis, and then outside there is a fibrous layer, that is adventitia. And now let's see about arterial supply. So in arterial supply we will divide esophagus in three parts: upper part like cervical, thoracic, and then abdominal. So cervical part is mainly supplied by esophageal branch of inferior thyroid artery. So inferior thyroid artery is which is so see, cervical part of esophagus is supplied by inferior esophageal branch. Cervical part of esophagus is supplied by esophageal branch of inferior thyroid artery, which is also branch of left subclavian artery. And then thoracic part is supplied by mainly 3 to 4 types of arteries, which is like esophageal branches directly from aorta like this. Then right and left bronchial arteries, so they also supply esophagus. And then in a lower part of esophagus, like in an abdominal part, it is supplied by esophageal branch of left gastric artery. So you can see this is left gastric artery. Now let's talk about nerve supply. Extrinsic nerve supply is done by this vagus nerves, and intrinsic nerve supply is by this orbic plexus and Meissner plexus. Okay, myenteric plexus is running in between this circular and this longitudinal muscles, as well as submucosa is having this Meissner plexus, which is required for secretions, but esophagus is not having that much secretions of own. Orbic plexus is required for peristaltic movements.